All right. So good morning, everyone. And thank you so much for joining us today. It was this week, 2 years ago, that the pandemic became real as schools and workplaces shifted to virtual operations for what we hoped and believed would be a few short weeks. But of course, we've seen a great deal of loss and death with respect to COVID and racial injustice in America. As the executive board of Chi Sigma Mu, we wanted to broach this topic of grief with our counseling student body, given how prevalent it's been over the last 2 years. Counselors have been at the forefront of the pandemic as we provide support to our clients who are grappling with an inordinate amount of loss. So we felt like talking about the skills and techniques related to death and loss is an imperative topic as we continue to navigate our changing sociopolitical climate. With that being said, it gives me great pleasure to introduce our wonderful speaker this morning. And the reason this is such a distinct honor for me is that our presenter was the chair of the Department of Professional Counseling at Monmouth University a few years ago, where I received my master's degree. So this is a reunion of sorts. So with that being said, Dr. Stephanie Hall is a licensed professional counselor in both Virginia and New Jersey. Her interests include grief counseling, multicultural counseling, women's issues in counseling, the professional identity of counselors, and group work. She's a national certified counselor, an approved clinical supervisor, and a certified thanatologist. Dr. Hall has 17 years of experience in the field of counseling and has worked in various settings, including community agencies, schools, and in private practice. Her clinical expertise is in grief and trauma counseling, and she is trained in EMDR. Dr. Hall, thank you so much again for joining us this morning, and I will go ahead and turn it over to you.
Well, thank you very much, and thanks for having me. I'm happy for the reunion. It's great to be here to talk about something that I am really passionate about. I'm going to go ahead and share my screen to make sure that you can see the presentation before I get started. You know, I'm a single tasker. I have to do one thing at a time here. Okay, can everyone see my presentation? Yes, good. Okay. So I wanted to start out just by talking about what led me into this area and why I think it's so important that all of us have some knowledge and background in grief. We were talking a bit about this before everyone joined the call, how, I think it should be required content in the training of counselors and all mental health professionals, because every single person you ever interact with will deal with grief. But for some reason, to this day, it is not. And I might talk as we go along about sort of why I think that is. But for me, when I was a graduate student about 22 years ago, my mother died. And as most counseling students are, sort of eager to do their own work, I tried to seek out a therapist to work with. And I saw several therapists over the course of about 3 to 5 years, and none of them really had any skills to help me with grief, beyond sort of the average processing of feelings, right? And I knew that this loss for me was so deep and so powerful that I needed something more than that. And so it sort of led me on this journey, and I ended up working for hospice and doing grief work in a lot of different settings, to figure out, like, what is the best way to help people through grief, right? Because we know, despite the fact that society tells us it's a 3 to 5 day mourning period, 3 days off work, we know it's long lasting and we know it's life changing. And so that's how I came to specialize in grief and trauma. And about, 15 years ago, I created a course in grief counseling that I've been teaching in master's programs. And my current program in Virginia, it's a required course, but it was an elective at Monmouth University. And so what I'm giving you today is an hour of what would be a full semester course. And please jump in and, ask questions. The part that I'm going to focus on today is sort of the normal experience of grief, because as we know in our profession, we tend to focus on what's developmentally normal first, right? And so in many cases with grief, the things that we sort of society sees as pathological are actually normal. And so I'll talk about, there's an upcoming diagnosis for grief that has not existed before. So I'm going to cover all those sorts of things. But just to start out with a couple of slides about like how to use these terms, because I know in many cases, grief, mourning, like those kind of terms are used interchangeably, and, in various conversations. But the one thing I want to talk about first is like how to define loss and how to define grief that's traumatic, right? And so George Engel is a psychiatrist who specialized in working with grief before basically anyone did. And he wrote about it in a way that he said, in medicine, right? So if somebody has a severe wound, that's a trauma to the body, right? And, a loss due to death is psychologically traumatic in the same way. So he said, basically, just as we could say that grief is healthy, we could also say it's pathological. And in order to help someone, we need to be able to clearly define what normal grief looks like and where it turns, toward pathology, right? And so writing about it in this way was really important for a couple of reasons. I mean, one, when you ask most people, even mental health professionals, what do you know about grief? They talk about Kubler-Ross, right, which I'm going to talk about a bit. But we know that sort of linear model of looking at grief is really not accurate, right? I mean, that her work was foundational for a lot of us to even understand some of the experience. But we know that looking at it in that way really doesn't work. So I always like to talk about this just because, I want us to think about it in that way, that as counselors, when you interact with somebody who's grieving, that's the first step, right, in helping them, is to understand, is this, a sort of normal average experience of grief, or is it something that requires a different kind of intervention? But we know that, and I'm going to talk about in a few minutes, mediators, what we call mediators of mourning, right, which is the process that you go through to adjust to a death. We know that there are all sorts of things that affect how somebody experiences loss, right, even in the same family, right? So two siblings could experience a loss very differently for all sorts of reasons. We're going to talk about some of those. But just know from the start, some people will adapt more easily than others, right? And I don't want to talk about grief and mourning separately. So grief, when we say that, we're talking about the experience of a person who's lost someone due to death. Mourning is that process of adjustment that we go through to adapt, right? And I want to talk about, just for a second, why this is focusing on loss due to death. And, often when people would join my class, they'd say, oh, we're going to talk about grief due to divorce and all sorts of other things, because you can have grief feelings about any sort of loss. Here's why I focus on death, because there's almost no other place where we get that training, right? And it's different, right, in several ways. Not minimizing that you can grieve, tremendously due to a loss of a friendship or a move or a divorce. But I think those things, most counselors are much better equipped to talk about and process than loss due to death. And it's a very specific kind of work. So that's the reason for the exciting topic. I enjoy talking about it, but not everyone does. So when we talk about normal grief, if you were to look at it in the literature, you'd also see it referred to as uncomplicated. So that's some of the language that's been used, is complicated grief versus uncomplicated, just to differentiate between normal and pathological, right? But it includes a really broad range of feelings and behaviors. And to make it sort of easier to understand, we kind of put them in 4 categories. So there are feelings or emotions, right? Physical sensations, which many people don't think about with grief, thoughts and behaviors. So those are the 4 categories. And even though, as I put the note here, all of you know, in mental health professions, we tend to focus a lot on identifying pathology and diagnosis, important skills to have, right? But what you should know is that most grieving people are experiencing loss normally. So the percentage of people that you interact with that are going to be experiencing sort of that complicated or pathological grief is very small, even when their behaviors might seem a little bit strange, right? So feelings, sadness obviously is usually the most dominant one and the most easy to identify. Something that makes the sadness about grief a little bit different than some other losses is the intensity of it, and the people have a fear that they won't be able to return to a normal state, right? So the sadness in many cases feels so intense, never experienced a sadness like this. Will I ever get back to the way I used to feel, right? And so people use that language like, I just lost it, I broke down, like that kind of thing. Anger, right? So I'm sure many of you on this call have experienced loss and you can identify yourself in some of these situations, but people can be angry at the person who has died. In my work, for me, I think that tends to be more covert. Like, I don't get a lot of clients who are raging at the person who's died, because I think there are all sorts of reasons why we don't want to feel that, right? So you may feel some of that. You may feel angry that the person you love didn't take care of themselves physically, for example, The important thing about anger, and what I try to tell clients, is we've all got it, right? Whether it's because we feel helpless that we couldn't prevent it. But if you don't acknowledge it and figure out where it is for you, right, it can lead to more complications. So, angry that you couldn't prevent the death, right? Also, I think all of us, experience sort of this regressive thing that happens when we lose somebody close because we feel helpless. We wonder if we can go on without the person, and I always think about this, like, when you're a child in the supermarket, you get separated from your parent or your caregiver, you panic, like, can I survive? Like that sort of, I think that instinct kind of kicks in, like, what do you do, right? And often the anger gets displaced. So, I could share lots of examples, but I had a friend whose child died due to gun violence, right? And so he and his wife became great advocates for gun safety and gun control. But there was a lot of anger that went in other directions, right? And we all need an outlet for it. And the problem comes, like, with any sort of mental health topic we talk about, when it's not adequately expressed and when it, sort of hurts the person who's experiencing the anger, right? So I think in many cases we want blame because we want an explanation. And important to talk to your clients about that. Just to say, everyone experiences anger. Let's figure out where yours is, right? And how you're expressing it. Guilt is another one that I see, probably next to sadness, the most dominant emotion. We tend to, like with my mother, we had a great relationship. I was very close with her my entire life when she was alive. But what I focused on? The one time I disappointed her before she died. And I mean, at some point you realize, like, well, if she had lived another 10 years, would I have even thought about that, right? But we sort of tend to look for things that we neglected, we could have done better, because now, and here's how this kind of loss is different, there isn't an opportunity to fix it, right? And so, that guilt that comes up in many cases, and in my class, I focus a lot on this because I think, identifying these feelings and sort of teasing them out, where they're coming up for people, is important. But in many cases, when we feel angry, we feel guilty, right? We feel guilty about sadness. Like, I remember the first day that I felt happy after my mom died, I felt guilty about it. Like, shouldn't I still feel miserable, right? And people talk about these things, like how much grief is enough. So, you sit with somebody who's just experienced a loss and you say, how do you feel? They may say one of these things, but odds are they're feeling all of them and they're tangled together, right? So we spend a lot of time, identifying these feelings and being intentional about how we work through them. Anxiety, I think this is important to say, it can range from sort of a small insecurity to full-blown panic attacks, right? So if you meet with a client who describes experiencing panic, in many cases, you may not ask them, and you may find out 6 sessions later, they experienced a death 3 weeks before. That changes things, right? So this whole, like, awareness of your own mortality that comes up, right? So, the closer somebody is to you when they die, like, the more that comes up for us. Like, I will die someday, right? And it may feel selfish to think about that, but we all do. So that causes anxiety, the fear of not being able to survive without the person who's died. All of these things bring up anxiety, right? So that is almost always there. And loneliness. Now, I just put this in. I talk a lot about loneliness with people because I find the research around it so interesting. Now, we're talking about sort of a clinical presentation, not like, I haven't done anything with my friends for a few weeks and I feel like disconnected. We're talking about true loneliness. Like, I feel alone even when I'm surrounded by others. One thing that is a strong indicator of real loneliness is people having a need to be touched or realizing the last time a person touched them. Now, you might be able to think about that now. And I might be able to remember that it was this morning, but this is something when people are experiencing like chronic loneliness that they're very aware of, the human contact piece. Fatigue. So just feeling tired, right? And that comes from the emotional and the physical sensations that we're going to talk about. Feeling helpless, shock. That's the other piece. Even if a death is expected, right? So even if someone has a terminal illness, you can still experience shock after the death. And that kind of throws people sometimes because they're saying, well, I've known that this was coming for 6 months. how do I feel so numb, right? Thinking about a death and the actual experience of it are two different things. And so there, those mediators that we're going to talk about in a few minutes, those affect sort of the length of the shock that people experience, but it can go on for months is the important thing to know to some degree. Yearning for the person, a feeling of freedom can also happen if you've been a caregiver for someone, right? And guess what comes after that? Guilt, right? So the guilt for me is almost always secondary. So I think like the appropriate thing to ask people is what feelings are you feeling, not just what feeling. How do you feel? What feelings are coming up for you? And I tell people they're always layered, right? But yeah, that, to normalize that for people, you can feel that sort of emancipation, even if you deeply love someone, right? So that doesn't mean anything about the relationship. Sometimes people have been oppressive. I have on a later slide, like you should ask people what the relationship means to them, right? So I remember I was supervising this young woman in New Orleans, and I was, watching her the one-way class, and she's sitting with somebody whose mother has died, and the first thing she said was, "You must be so sad." And the client said to her, "My mother made my life miserable. I feel relieved." And the counselor's like, "Uh-oh, like, what do I do now?" I mean, we can't assume these things, right? And so sometimes there is relief. There's relief because the person isn't suffering anymore, right? The thing that I see with almost every one of these feelings is, and it's sort of across age, culture, gender. I mean, people telling themselves they shouldn't feel this way. Like for some reason, we don't give ourselves permission to feel anything about grief, right? And so like, that's what I see over and over again with people is that no matter what they're feeling, they're telling themselves they should feel differently. And that's why I think, we always talk about normalizing and validating, but with this kind of work, it's crucial to do that. And just to tell people, like, I want you to know what's normal, right? That doesn't mean you wouldn't tell them if they were experiencing something that is not normal, but in most cases they are. And I talked about the numbness. So just an important point there. There's no evidence at all to suggest that that's unhealthy in any way, the shock or the numbness, right? So physical sensations, what might you feel in your body? Well, none of these will surprise you, I'm sure. Maybe the overly sensitive to noise, right? That sort of thing happens. Sometimes what's really troubling to people is this, when we talk about depersonalization. So like, I remember at my mother's funeral, and there were so many people there, and it's just, you're overwhelmed, you're tired, emotionally drained. But I remember standing in the room and feeling like I was watching a movie, right? And as a mental health counseling student, I felt like this, is this dissociation? Like what is happening? It would have really helped me if I had known at that point in my life that was a normal experience, because I felt a little panicked about it, and it only lasted a minute or two. But that kind of thing happens with grief, and it's okay, right? It's normal, and it isn't persistent or long lasting. The other thing I want to talk about is the breathlessness, right? So this could be anxiety, but the body sort of knows that there's a trauma, and I think we hold ourselves in a tense way, right? And so they've actually done studies about grieving people, measuring the rate of breaths per minute and that sort of thing. And it really is similar in terms of the outcomes to people who are experiencing like major depressive disorder, right? So they're not the same thing, but there's a physical impact on the body. And sometimes, when I look at someone in a session and they're talking about grief, I see them so tense and I see that they're breathing shallow, right? And I'll stop them and try to get them to acknowledge that, relax in their body. But that breathlessness is normal. But again, if you think about all the emotions we're talking about combined with some of these things, it's no wonder that people feel like something is really wrong with me, right? Lack of energy, all of these things, completely normal, right? So in terms of thoughts, I'm just going to talk about them like categories here. And there are interventions to address each of these. But when we talk about the shock period, that disbelief that happens there, the thoughts about, it didn't happen. There must be some mistake, right? I keep waiting to wake up from this. I had a client years ago who talked about driving on the turnpike and maybe seeing somebody they thought looked like their parent and trying to catch up to them. right? Because it's like that sense of disbelief and saying, like, I know this is not real, but I feel compelled to look, right? And so it's that, like, your mind sort of trying to accept that this is a reality, feeling confused, even preoccupied. So sort of obsessive thinking about the person who's died, intrusive images, ruminating on things. And again, we're going to talk about a timeline here, but in most cases, these things resolve and they come in waves, right? And so, you're not going to have a client who's going to be hopefully experiencing this for more than a year. But, in the first few months after, this absolutely happens. And again, I think it's that, your mind trying to reconcile between the shock, which is protecting you from the pain, right? And the images, which are reminding you that, yes, the person has died. And a question that I get a lot about children particularly, but in general, how important are funerals, right? Like, some people see them as more traumatic. Like, is it important for people to go? What I will say is that funerals and rituals help with acceptance, right? So this particular thing we're talking about with disbelief, they do help with that. It doesn't mean if you don't go, you're going to absolutely have a problem. But, we do those things for a reason, right? And so they do help with closure and acceptance. The other thing I want to talk about is a sense of presence. Children describe this a lot, particularly when a parent dies. And, mommy came to my room, I feel like I'm being watched by the person. The important thing here is whether the person, the kid or the adult, finds it comforting or scary, right? And so that would be how you would work with it. But in many cases, with children, it's the surviving caregiver that doesn't really like this topic too much. Like, it kind of freaks me out. But, in many cases, and who knows, right? I mean, whatever your spiritual beliefs are, I would say, I don't know, it could be possible, right? It could be possible. And so if it's comforting, we're going to go with that and, sort of like lean into it a little bit. Again, we're still focusing on what's normal. Hallucinations, right? This is probably the only time you'd ever hear me say hallucinations are normal. But what I mean is, like, a lot of people, and again, across culture, will hear the person's voice calling out to them, right? I can't explain what that is, right? I can't explain it. What I know is that across the board it happens, right? And it tends to dissipate as we start to accept the death. But even visual, like thinking you see the person, right? I mean, no one answers the phone anymore, but 22 years ago, we all talked on the phone. And I remember, like, every time the phone rang for probably 3 months, I thought it was my mother calling. I'd tell myself it wasn't. But at one point I thought I saw her, right? Of course I didn't. So, I think just normalizing this for people, and then again, focusing on, is it comforting to you or is it a scary thing? And so, where is it coming from and where do we go with it after that? So behaviors. These are often the things that get people into counseling, right? Because their friends and loved ones see some of these things and they say, oh no, what's happening here, right? Sleep disturbance, normal, right? Trouble going to sleep, waking early, usually corrects itself in time. People report a lot of waking up with really intense sadness, right? And I don't know what that's about. When we first wake up in the morning, I know for me, my first thought goes to the terrible thing I did the day before, whatever that was. I said the wrong thing in the hallway to somebody. I don't know. But, this is something that comes up for people, is this real intense sadness. And so one thing that I will talk about with clients when they report this is there some sort of routine? Is there something we can do that will counter that a little bit, right? Like, put on your favorite music, talk to someone, because sometimes, our waking rituals are connected to the person who's died, and that matters. So appetite, overeating, undereating happens, forgetfulness, social withdrawal. I always think about this. How many times can you hear, I'm sorry for your loss, before you want to hide? I mean, I don't even know what to say to that when people say, I know it's meant to be a comforting thing, but basically anything that reflects a feeling or offers support is better than I'm sorry for your loss, right? But important to know that the social withdrawal usually is short-lived. Like, people usually, and if you're working with clients who are grieving, you definitely want to encourage them to be connected to the people they care about. But if they find themselves withdrawing more than normal temporarily, I think that's okay. It's all about awareness and intentionality. So if you feel like you need the day off, you don't want to talk to anybody, it's okay to do that. I think I see something in the chat. Is that right? Saw a little flash.
I
Yeah,
think
it's not comforting.
that,
Agreed. Agreed. Yeah. I mean, I don't even know what you're supposed to say. Thank you. I'm sorry for your loss. Thanks. I don't know. Right. But I think, we understand that this is the biggest cringe for me on Facebook when somebody posts about a death and I see 43 posts. I'm sorry for your loss. I'm like, could you say anything else? Just anything. But generally something that offers support and reflects a feeling is a better way to go. What else do I want to say? Oh, dreams. So again, often reported, sometimes nightmares, sometimes pleasant. In general, I don't do dream interpretation. It's not something that I'm trained in. What I will talk to people about, though, how did you feel when you woke up? What were the dominant themes? And let's see what they're connected to in real life, right? And, they can often be connected to something unresolved. And so then you can help process that in therapy. Avoiding reminders of the grief, so hiding things that belong to the person. This is an interesting thing. People ask me all the time, my friend just lost her husband and she hid all of his clothes and she took down all the pictures. Is that normal? If that's what she needs to do, yes. Odds are they'll come back out, right? I had a client whose husband died of a heart attack unexpectedly. And, I saw her for about 8 months. During that time, she packed up his clothes and unpacked them 3 times. She took the family pictures down and she put them in the closet and then she brought them back out. And she kept saying, like, sometimes I can't look at them. Well, that's okay, right? Like the thing to remind people of, these things are not permanent, right? They are not permanent. And so if you need to do that for a few weeks, right, fine. But again, to the people who are around her wanting to support her, they don't know what's normal, right? So maybe you should leave them out to get used to it, right? But avoiding reminders, normal, right? Searching and calling out for the person. The restless hyperactivity, right? Feeling like you can't sit still, like I'm coming out of my skin. I can't stand to be home, right? Crying, obviously. Visiting places or carrying things that remind you of the person. Again, connection is helpful, right? And basically, what we would say is that anything within a year is normal, right? So you got to get to the first anniversary of the death before you even start to think about whether or not these things are a problem, right? If we're 3 years in and the person is still experiencing these things, that's very different, right, than 6 to 8 months. But consider this, how long does it take for friends and loved ones to stop asking you how you're doing after somebody dies? Probably a month, maybe 6 weeks, maybe longer if you're very close to the person. But to know that this experience goes on for at least a year, right? And so one thing that I do when somebody close to me has a loss is I put a reminder in my phone for 3 months, 6 months, and a year to check in with them, right? And that's just a way that I keep connected to people that I know are still in this way after people have stopped showing up and asking. So, but again, I always get the questions about, the person has a shrine in their house, like they're wearing the clothes of the person who died. And, in many cases, if it's comforting and if it's within that year, it's fine, right? And I wanted to just say this too, that, I know that many lay people use the word depressed to mean sad. So most of the time when we hear depressed or depression, people don't mean a diagnosis. But when we're talking about diagnosing, right, grief and depression can look similar. And I think, we still don't have a diagnosis for grief, but it appears that we will, maybe as soon as this month, when the new DSM comes out. But, I think in the past, people would tend, for insurance coverage and things like that, to diagnose people with depression, adjustment disorder, that sort of thing. But they are 2 different things, right? One of the ways to tell the difference, depressed people tend to have negative evaluations of themselves, the world, the future. That can happen with people who are grieving or in the mourning process, but it tends to come and go a bit more, right? It's not as persistent. And there are, again, if we were going to go into talking about complicated grief, there are some people who do develop major depression after a loss. That's different than what we're talking about here, and not for at least a year, okay, before you diagnose that. And sort of like, if we were in the course together, we'd talk about what happens when somebody already has a diagnosis of depression and then they experience a death, right? Because that also happens. A lot of the clients that I've seen, I've been seeing them for another reason, and they've experienced a death in the middle of, our work together. So that informs how you work with the client too. But I just want to say to be careful not to jump to a diagnosis of depression, even if you see that the person meets some of the diagnostic criteria, if they've experienced a death within that year time frame of somebody very close to them, right? I mentioned Kubler-Ross earlier. I always feel like I need to talk about her a little bit because there is some valid information there. But, like many things that we face in life, different theorists have tried to understand this in different ways. Stages, phases, tasks. Those are the three main ways, right? So Kubler-Ross looked at stages, and she worked initially mostly with dying people, right? And so it was like people accepting their own death. The problem with stage models is that we know grief is not fluid, right? We do not move from anger to denial to acceptance. So we know that that's true. And so that's one of the flaws of that kind of a model, is that it doesn't exactly fit. The model that I use is William Morden's model, and it is a task model, right? And part of the reason that I use that model is because not only does it sort of fit with my understanding of death, but I think when you work with people around these tasks, it gives them hope, and it gives you some direction in therapy. Because the one thing that you don't want to do is just sit for 6 months working with somebody and talk about sadness and anger, right? So there has to be some goal direction here. So I'm going to talk about these tasks and the mediators and sort of how we work through. But when I explain this to clients, like, these are the tasks we're going to focus on. We're going to see where you are with each one, and the interventions are designed to move you through those. People tend to feel hopeful, right? Like, oh, so there are things we can work on and be fixed, right? So that's not, I won't be stuck in this forever. And we know that, with any task model, you think about your human growth and development classes, right? Any development is influenced by various tasks. So that's the other reason why I think it really fits. Like, if we look at sort of task models for our physical development, social, our emotional development, why wouldn't we do it with grief? So that this is my argument for why it's the way that I look at working with grieving clients. So the first task is to accept the reality of the loss. So as I've said before, everyone experiences some shock, right? And even when you're in full acceptance, right, there's still a part of us that has a hard time believing and accepting the person is gone and won't return. Part of the acceptance piece here, and in my class I talk a lot about spirituality, but it's to come to terms with the fact that reunion is impossible in this life, at least, right? So if you have spiritual beliefs that tell you something happens after your death, that gives people a lot of hope in many cases, but at least in this life, we know that reunion is not possible. And I mentioned this earlier that, early on after a death, people may find themselves seeing people who look like the person, think the person's calling, having to constantly remind themselves that it isn't the deceased loved one. One of the things that is very important for counselors to do to help with that acceptance is to use, we call it language that actualizes the loss, right? Don't say passed on. Use language that describes what happened. The person died, right? And, I could talk a lot about this, which we don't have time for, but I think a big piece of the reason why we say passed on or things that seem nicer, kinder, is because of our own reluctance to face it, right? So it's sort of society's way of avoidance. And so, I will say to clients, when they hear me saying died, if they continue to say passed, I would say to them gently, the reason that I say died is because of this. Like, I would explain to them why. Because when we have trouble accepting it, using that kind of passive language doesn't help us at all. And denying the loss, can go from sort of a slight distortion, like seeing the person and having to tell yourself that it's not them, to full-blown delusions, right? So I'm sure you've all heard the story. I've heard it many times. Her husband died 5 years ago. She still lays out his clothes for him. She cooks breakfast for him in the morning, right? I can tell you I've never worked with a client who's done that, right? I'm not saying those cases don't exist, right? I have worked with a lot of people who have trouble letting go of ritual, right? And we always, here's the thing. Does it interfere with their life? I mean, that's, basically any sort of diagnosis or problem we're working with. If the person pours an extra cup of coffee in the morning, is it interfering with them getting on with life? I don't know. I mean, there are a lot of other factors to look at, But that's one thing to think about, when you sort of see that distortion is both how long has it been and like how does it really impact the person adjusting or getting through the loss, right? And so I did put this here that with rituals, not seeing the body of the person after they've died can make it more difficult, right? And it's just an acceptance thing. And by the way, I never tell people what to do with their children. Should I take my kids to the funeral? I think it might traumatize. You know your children better than I. I'm not giving you any advice. This is what I will tell you. It can help with acceptance, but you have to decide and sort of weigh, if it's important enough that you want to expose your 5-year-old to it, right? I will say this, my opinion is that in many cases, we project on children our own fears, right? And so in many cases, children deal with things far better than we give them credit for, and actually do better with more information, right? So the fear comes in without information. So that's my feedback on that. So task 1 being the acceptance piece, right? And you could work with somebody on that for many sessions, okay? The second task would be processing the pain. I think there's a comment or something here. Let me look. Yes, to Christina's question. So she's asking about having a gravesite to visit as opposed to cremation helps. I do think it helps. I can't sort of give a generalization about if you go this often, it's better. I mean, I don't know. That varies from person to person. But I think for many people, especially in that adjustment period, it's helpful to have a place to go with your grief, right? Having said that, though, I've known people who have adjusted perfectly fine without it. But I think it does fall in that category of ritual and how, anything that sort of helps you with the connection, I think can help with the mourning process. So when we talk about processing the pain, if we believe, which we do, I do, that it's necessary to experience and work through pain, I think that's something that counselors all could sort of get on board with. Then what we could say about that is that anything that allows you to avoid or suppress is going to prolong the mourning process, right? Anything that lets you avoid it. Not everyone experiences the same intensity or feels it in the same way. There are personality variables and all sorts of things, loss history. But what we want to talk to clients about is are there signs of avoidance here, right? And often that can be seen in, drinking more, overworking, getting another job, there's sorts of things people do to avoid. That's what we don't want, right? We know that society gets in the way. Society supports avoidance of pain, right? So I've heard people say, it's been 2 months and she's still crying every day. Her talk is so morbid. It's well, no, it's normal, right? So, we say things to people that are so unhelpful. You're still young. You can have more children. He or she wouldn't want you to feel this way. First of all, how do you even know that's true? I kind of want people to be sad for a little while when I die. I don't know about you. I think it's I don't want them to have a party the next day. But that, that's sort of dismissive and validating. You should be doing something other than what you are. We want to stay away from that. And society often stigmatizes grief, unhealthy, demoralizing, right? Some people physically leave to try to find relief, and then, others are judgmental about it. But, I did that. I moved to another state 3 months after my mom died. At the time, I wasn't aware that that's why I was doing it, right? It was sort of let's live life. Ultimately, it turned out to be fine. Guess what? It follows you, right? But people do sometimes. And you'll hear these judgmental comments she's on a cruise. It's only been 3 months since the person died. Well, good. I'm glad that someone can take care of themselves, right? But what we know is that sooner or later, if we avoid it, we have to return to it, right? We have to experience it somehow. And what I often tell people is, as painful as it feels now, if you're trying to return to it and work through it 2 to 3 years from now, it's going to feel more painful, right? And so that working through it in the moment is far better if you can do that. The third task, adjusting to life without the person. So these are all things that we cover and talk about in therapy. So there are sort of external and internal adjustments, right? Externally, what we're talking about is what is lost? What roles were played by the person, right? So if it was your partner, what did they mean to you? What did your day-to-day life look like, right? Were they your cheerleader? Did they pay all the bills? There are sort of practical things involved here too. And sometimes the survivor may not even be aware of all those roles until well after the person's gone, right? Sometimes people are so deeply interwoven in our lives that, it's hard to articulate all the things that they do and mean to us. So the practical and the more, internal emotional things. We also want to talk about sort of internally, how does the death affect the way you feel about yourself, right? So who am I if I'm not her daughter, her partner? Who am I then? We'd all like to think our self esteem is not attached to others. We know that is not true, right? In most cases, it is in some way, right? The people we love often make us feel good about ourselves, right? So you'll want to address that question of who am I now, right? And people will often say, I'll never be the same. And what I say to that is, nor do we want you to be, right? We're changed by these things. Let's talk about how, right? And spiritually, you cannot do grief work without talking about spirituality. It's impossible. Whether the person has beliefs or not, right? It brings these things up for us, probably because we're thinking about our own mortality, right? Where the person is now. But important to point out, it can change, right? It can change the way you see things, right? People can become more religious, right? They can withdraw when they were previously very spiritual. Bottom line is, if we can't find an answer, we have to learn to live without it. And so part of finding that answer for many people is in spirituality. And so you'll need to do some of that work with them. Right. And then the task 4 that we talk about is learning to have an enduring connection with the person who's died while still moving on with life. Right. So how do we, and this is a thing, like I mentioned, the first time I felt happy, I felt guilty. How do I move on and experience life in a fulfilled way without this person that I always saw there? And how do you get to a place where you can say that there are other people to be loved, and it doesn't mean that I loved this person any less? That's a hard thing to do, right? And one of the things we talk about a lot in grief work is making meaning of the loss. I can tell that someone is adjusting when they start to use language that describes a meaningful experience, right? Like, this was so painful and horrible, but this is the ways I'm better now, right? Like, life means more to me now. I'm drawing closer to the people who are around me that I love. I try to teach clients to use this language about making meaning, but you can hear that reflected in the things that they say when the adjustment starts to happen, right? And so when we talk about task 4, we might help clients figure out ways to make meaning. There are the most obvious ways, like somebody dies of cancer. You start to do some like fundraising around, the particular kind. I mean, there are ways people figure out how to do this. You can become a grief counselor, like I did. Not everybody needs to do that. But I think there are ways that people find to make meaning, and you can help them do that if they can't readily identify them. And it doesn't have to be some huge gesture either, right? It's just that something comes out of it. You're transformed, right? And not only in negative ways. So I'm going to go through these a bit more quickly. But when we look at any client in front of us, I referenced these before, there are these mediators. What we mean by that is these are things that affect the mourning process, the grief experience, right? And there are a lot of them. So like when I'm working with a client, I'm trying to identify where they are with these tasks, and also looking at all these mediators that affect how they're interacting with the task, right? If that makes sense. So first one, who was the person that died? Right? Relationship and expectation can vary. So the way you feel about your father, your grandmother, whomever, may be very different than the person sitting in front of you. So, talking to somebody about like relationship, for me, if my mother were alive today, what would I expect our relationship would be like? That would give you some insight, right, into what her roles were with me, what she meant to me, that sort of thing. The second one, we all talk about attachment quite a bit, right? And it definitely comes into play with death. How strong was the attachment? How much was the relationship attached to the sense of self? How much ambivalence was involved? So when we talk about ambivalence, all relationships have a little bit, right? So ambivalence can equal guilt, right? So what we mean there, unfinished business, right? Things about the relationship that you wish were stronger, that you wish were different. Those kind of things definitely are things that affect the grief experience. If the client was at all dependent on the person that died, that is another thing, related to attachment that can affect the mourning process. Now in the class, I go into like, separate sections to talk about different kinds of death and how they impact grief. But just know that a natural death, different than suicide. That probably seems very obvious to you, right? In a lot of ways. Homicide, right? So we know that suicide, I mean, any death that's seen as preventable sort of goes into a different category for people with grief, right? In terms of acceptance, how to move through it, and that kind of thing. This might be a surprise to you. Proximity, where you were when the death happened. So if you're in the room with the person versus in another state or in another country, that's going to affect the way that you move through the mourning process. Was the death sudden, expected, violent, or traumatic? So for me, early on in the grief work in the relationship with the client, I'm finding out this information and sort of like, tuck it away to decide, like, for instance, if the death was sudden, how prolonged is this shock going to be, right? How does it impact all the emotions we've talked about, right? So if the death is sudden, is there more anxiety, right? Is more of that own sort of feeling of your own mortality coming up, right? Multiple losses. The one thing I'll say about that, with our limited time, they need to be processed separately, right? So if a person experiences the death of 2 or 3 people at one time, what I generally say to them is, we will work through all of them. Let's decide which one to address first. It doesn't mean they won't bring them up, during the course of the work. But I see it as my job to keep them on track with, processing each one individually, because, all these things we're talking about, they can be so very different, the relationship, the experience of the death. So ambiguous loss, the absolute hardest kind. We assume the person's dead, but there's no proof, right? I mean, imagine how that influences your, the questioning, right? And stigmatized deaths. I mean, thankfully, this has changed a lot since my work began so many years ago, but certainly it still exists, right? So, I had a close friend in graduate school whose brother had died of AIDS, and, the whole family, I mean, they told a story that it was something else, right? And years later, that was still bothering her, that they sort of hid the real reason. So, all of these things they affect the mourning process, and they can get in the way, I guess, is what I want to say of moving through it. Fourth mediator, you always want to do a good history. So what losses has the person experienced before? And what was the mourning process like for them? Right? So if I experienced a loss 10 years ago and I feel like it took me 3 years to get through it, what do you think that says about the loss I experienced today? It kind of becomes a blueprint, right? And so then you would want to talk to the client about how to make this different, right? Why the previous losses happened in the way that they did or were grieved in the way they did. So mental health history is important, right? What we also know, and again, this is something I find really fascinating in my own family and the people that I've worked with. Unresolved grief can transcend several generations in a family, right? And oftentimes we learn about how to grieve and we learn about how to move through this by watching our caregivers, right? And so, for instance, my mother's mother died young. I grew up listening to her, because I never met her, talk about her mother. Don't you think that impacted the way I grieved for my mother when she died? 100%, right? And so I do something with clients like genograms, which we've all done with grief, right? And to talk about sort of the family patterns, how grief has been dealt with or not, because that influences the way, your client is experiencing it. So this is a whole lot in Mediator 5 here, but a big list, right? Age, gender, coping style, attachment style, all those things. Right? This is why I sort of shake my head when I get an email. My client's mother just died. Can you give me some tips to help her? I mean, look at all this information. Like, come and take a class, But all these things affect it, right? And so this is why you can't just sit down with your client and say, write a letter to the person who's died. I mean, you can do that. Lots of people do it. But you see how this can be a whole work rather than just a couple sessions talking about sadness, right? We know that around gender, people are socialized differently around gender, right? And so the experience of all the feelings can be impacted by what we've been told is normal. And so we know, and then like when I teach the class and we talk about the death of children, many times heterosexual couples have a very different experience of grief. And in many cases, marriages break up because of this sort of lack of understanding of how, gender impacts grief. Coping style. We all know about coping styles, right? You can probably guess that the least effective is avoidant, right? Active emotional coping is the best. So that's the person who can find something positive in a bad situation. The use of humor, within reason is a very positive sign, right? If somebody can still find a reason to laugh, ability to accept support, also very important, right? So, is the person generally optimistic prior to experiencing the death? Are they prone to rumination? Those things impact it. Ego strength. And for me, this is maybe the most telling thing is the person's worldview. So with clients who, for example, I've known prior, I can make some assumptions about how they might cope based on their worldview, right? So if I am a person whose worldview includes most people are there for me, they're supportive of me, I can cope with things, I'm generally okay, right? The world is a trustworthy place, I'm going to do a lot better, right? Again, the opposite is not a prescription for problems, but you can sort of tell how people might cope based on knowing those things. Could talk a lot about social support, but what I want you to know is that perceived support is what's important. So I could be surrounded by people who are willing to support me, and my perception could be that I'm alone, right? And so, I'll talk to clients about that. What are your social supports like? And I'll talk about it in layers. So there are the people that you can call anytime. Who are the people that you think you could call, but you probably wouldn't? And there are probably even people beyond that would pick up the phone and support you if you needed them to, right? And so really those layers are important. And as I mentioned before, one thing that's difficult is that, right after a loss, there's often a lot of support and we're in shock, right? We're not ready for it. 6 months later, when you're realizing all those roles that are lost and things, people have gone away. So keep showing up for people. But I'll ask people, are you satisfied with the amount of support you have, right? Talking to people about what their own social roles are, right? Are there religious resources they have? Are there cultural, ethnic expectations about the length of mourning? Because sometimes there are, right? And how to do it. Those are all important things. So what other stressors are going on in life and when are you finished, right? So life is happening all the time. And in most cases, when we experience a death, there are other stressors that are playing a part. And so we want to acknowledge those and sort of see them as separate things to work through. But there's really no right answer to when mourning is finished. So, one general way to look at it as a therapist, like when those tasks are accomplished, right? If you really need a way to look at it. What we know, though, is that less than a year is too short, right? And for many people, a couple of years isn't too long. But one thing we look at is, when the person's able to think about or talk about the person who's died without fresh pain, then that seems to be an indicator of moving through. Anniversary reactions are common for up to 10 years or longer. Think about that, a decade. And we're talking about the anniversary of the death, right? Does not indicate chronic grief just because anniversary reactions are happening. So 2 to 5 years after the death, the person's saying, I'm not getting back to life, this doesn't feel like it's ending, then we know, right? So if you are seeing sort of a chronic grief reaction, and I'm about to talk about the upcoming diagnosis, then you would sort of look at which of those tasks aren't being resolved and which of those mediators are influencing it. And then your interventions are focused on resolving the tasks, right? Whichever ones the person is having trouble with. So I said this, use language that actualizes loss. He died, right? Normalizing feelings, encouraging connection. I would say that connection to others and social support is the biggest predictor of recovery, right? And so, I always say this to clients and, I say it to myself. In most cases, people love and support us and they just don't know how, right? And sometimes we don't feel like we have the energy to ask, but there has to be a way to connect, right? And so if people are saying to over and over again, let me know what I can do, then I'll say to the client, what can they do? Let them do it, right? So that, encouraging people to stay connected and preparing people, right? So grief can feel like a roller coaster a little bit. There may be those feelings, sad one day, okay the next. But for most people, and then there can be relief prior to this, at least a year, right? And so, I see people sort of take a deep breath when they hear that. I'm like, so it's been 2 months and this is still okay? Yes, it is, right? So a diagnosis is coming. Last thing I want to mention, and then we will have a few minutes for questions. But so the diagnosis that's coming is called prolonged grief disorder, right? The DSM is supposed to be released in March. I haven't seen anything about it yet, but that's what they're saying. It's coming out in March. And so I put some information here with the diagnostic criteria. And this was heavily debated. it almost made it into the last DSM, but we could not agree. So if you want to talk about the problems with diagnosis, we could get on that topic. But what we've agreed upon is that it has to be at least 6 months for children and adolescents post death, post loss, or at least 12 months for adults, right? And so, these are a lot of the things we've been talking about, that, grief reactions occur most of the day, nearly every day for at least a month, right? Again, I talked about this. The individual experiences clinically significant distress or impairment. So we always look at that. How does it impact life, us getting on, right? So in social, occupational, or school, when we're talking about kids, any important areas of functioning, right? And this is interesting because I know, like Suni had mentioned, COVID. And so, the APA president, in talking about this, the release of this new DSM and the upcoming, inclusion of a diagnosis for grief, has said, anytime a diagnosis is presented, it gets used a lot, right? So this phenomenon of like, now there's a diagnosis for grief. Everybody I see is going to get it, which we know is problematic. But the other thing President talked about is that we're living in a time that may make this more prevalent anyway, because we've all experienced so much death and without much time to cope with it before we've probably experienced another one, right? And so, what we need to know is that environmental and societal factors can also influence our experience. So here are some of the symptoms for this prolonged grief disorder. But, I guess, and again, we don't have much time, but I have mixed feelings about a diagnosis for grief, right? We know that there is pathological grief. The big problem has been always that if somebody went to a therapist and that was their presenting problem, there was no way to get it covered by insurance. So misdiagnosis happens. So we need one. But again, I look for this criteria to evolve in the future. This is our first attempt. But good now that people can go and get treatment, right? Just know that most of the people you see are probably not going to fit the criteria for this prolonged grief disorder, but it will be appearing soon. So that I took a bit longer. We're right at 11 o'clock, but I'm happy for questions that people have, or to talk about anything that you would like. I have more time, so.
First and foremost, thank you for that, Dr. Hall. That was incredibly informative. And again, something we don't talk nearly enough about. I know I'm walking away with a lot more knowledge, and I'm so appreciative. I do have one question from a colleague of mine.
Sure.
And for everyone else, please feel free to drop your comments and questions in the chat, or feel free to unmute yourself. But there was a question about, do you explain the task model to the client before you begin the process?
I do.
Mm-hmm.
I do. Yeah. So initially what I do is 1 or 2 sessions. I don't want to call it history taking, because I think you're still for me, it's getting a sense of who the person that died was, who they are to my client. And then I sort of move into, here's how we're going to work through this, right? So you're information gathering the whole way, but I do explain to them, not in quite as much detail as I just did with you, and certainly not as much as I do in the class, but that, the model I use is a task model. And so the first piece we work on is acceptance. We work on processing the pain. We work on, understanding how this person's going to fit into life as we move forward, and so in that way I do explain it.
And it also sounds like it provides a nice roadmap for what clients may expect in the process. So it kind of demystifies
Right.
it.
Yeah. And it's just like, any other counseling situation you've experienced where people come in and they're in pain and they say, how long is this going to take?
Yeah.
So that's a place to address it too. It'll take as long as it takes is not an answer people want to hear. But in general, with most sort of uncomplicated grief, so we're not talking about that diagnosis, 10 to 12 sessions, people generally feel much better.
Mm.
So it doesn't have to be really, really long term.
Wonderful. Are there any other questions that folks have? And again, feel free to unmute yourself, or if you want to drop it in the chat, I'm happy to read it out. Or just general comments.
I'm interested in hearing a little bit more about how, if a person has had past grief, how a new loss might kick up old grief and how that's dealt with.
Yeah, it definitely does. I think the first thing to think about is whether or not that past grief was resolved. And I hesitate to even use that kind of language, but if I have experienced all the feelings associated with the grief, if I've sort of dealt with the unfinished business, I might still have some residual sadness about it, but I'm in basically an okay place. It might still bring up some things, but probably my focus is going to be on the current loss, right? If that grief is unresolved, or if it happens too close in proximity, so like my partner experienced the death of a father and a brother within a year. Well, I mean that, I imagine how that's compounded, or if people die at the same time, right? So, I think the timing matters, the person's general mental health matters, and how they moved through. And so that's like, I've covered this in half a second in this talk, but, one of the things I'll discuss with a person is like, what's your roadmap for grief? In other words, if you've experienced it before, what did it look like? And a lot of times people, if it's been a long time, they won't remember a lot about it, right? They may remember a few key things. And so we'll talk about how that is or isn't coming up in the current situation. But yeah, I think, for most of us, the first loss we experience is sort of foundational. And, the way we move through it, the age we were when it happened, all those things, like they come into play for our understanding of how to move through it in the future. So, it doesn't sort of sentence anybody to a certain experience, but it definitely interacts with it in several ways.
Thank you for that, Dr. Hall. And we have another question in the chat. If a client has a loved one who's dying, do you have any tips for how to support them before the death occurs? So it kind of sounds like that anticipatory group.
Yeah. So I didn't really even talk about that, but thanks for bringing that up. Yeah. So one of the things that happens with anticipatory grief is that people can change the way they relate to the person, right? So they can sort of throw themselves full force into the relationship and try to spend every minute with the person who's about to die. They can go the opposite direction and kind of start to withdraw from the relationship before the death happens. Most of the time that's unintentional, right? But the one thing I want to help a person do is to be intentional about how they do things, right? And so if we know that this person you love is going to die, what needs to be said? And so maybe helping them figure out how to say it, just to be intentional, make choices. And what I'll say to people, which I think is absolutely true, no matter what you do, it is not going to prevent you from having pain later. That's what we tell ourselves, right? I can do all this now. It just doesn't happen in that way. And so what we want to do is, put you in the best situation where you think, I've said what I could say, I knew my mother was going to die. I got to tell her that how much I loved her many times. Still, after she died, I felt like it wasn't enough, but I think there are certain things that could turn into unfinished business that you could address before the death. But for me, a very general answer is just helping the person be intentional about how they move through it and helping them get support along the way. Because that, different kinds of losses affect us differently, but when a death is anticipated, I think there are so many more layers to it. There's a lot of room for guilt, I'll just say.
Just to piggyback off of that question a little bit, Dr. Hall, do you think that it's hard for those people because they've already in some kind of way anticipated that death? Like they've already probably, they may have thought they were dealing with it before and that's why the shock happens. Yeah,
I think so. I think, when it's anticipated, we tell ourselves that we're okay, right? My closest friend from childhood, her father died in a car accident. And so she was real close to him. And we were about the same age. And so we have talked about our experiences so much because we know each other so well. Like, was mine harder or was hers? Because I watched my mother. And the answer is like, who knows, right? But the one thing that was different is like the period of shock for her lasted so much longer because he was fine and he walked out the door and never came back, right? And for me, I had this period where it was like looking at my mom thinking like sometime soon she's not going to be here. What do I need to do? So that I feel like, and it's not true in all cases. In my case, I felt like I was thankful to have that, but they just, like that's why we use that language, mediators. They just affect us differently. And so, some people experience a lot of trauma seeing somebody in the death process. And so that has to be dealt with. And so in that way, you can't say one's better or worse, but I think most people definitely tell themselves they're going to be more prepared when they have time. But I don't know that that's always true. You know, how can you prepare for the reality of it? You can think about it, you know. We all know that, though. Think about something and be in the middle of it are two different things.
I have another question, Dr. Hall. I'm sorry.
It's fine.
For individuals who grow up in areas where death is very prevalent, how do we work with those individuals where, like, if it's high crime, or I don't like using that, but like if
Yeah.
you know what I mean, like if there's like high crime, or they're easily can see violence a lot or death all the time, and then something personal happens, like do you feel like they become desensitized in a way, or
Possibly. I mean, I guess, and we've all probably heard about and talked about, these adverse childhood experiences, the ACEs, like that, or how important and impactful they are. Would they play a part? Absolutely. Right. But all the things we've talked about are still going to matter. Like the nature of the relationship, how much the kid's self-esteem is attached to the person, right? How close in proximity they are to the person who's died, right? What you may see as different is the child's ability to talk about death, right? When they've had language for it, when they've experienced it. But still, there's a lot of talk about like even seeing violence on TV and how that impacts kids, right? Like, can we say that it doesn't? No. I mean, certainly it has some impact, but I don't think it's like as easy as like cause and effect, right? Like if a kid has seen a bunch of death, is it going to make it harder or easier for that? Well, I don't know, but I think, all these things play a part. I would say, like with any of those sort of adverse childhood events, they impact our development in so many ways, right? So the kid's ability to cope or talk about feelings or things like that may be impacted by it in all situations.
Thank you again, Dr. Hall, for answering all these questions. And if anyone has anything else, I suppose we could take one more. Oh, okay. Yeah, we do have one in the chat. Any thoughts or tips on grief groups in the high school environment for school counselors?
Yeah, I think they're crucial. For all of us, when we experience death, we tend to think we're doing it differently than everybody else. Like we tell ourselves we're doing it wrong, we're doing it straight. And so, we know this about groups in general, right? But they go so far in terms of normalizing and validating. The one thing I would say as a caution is, and this is not just for high school counselors, but when you're putting together a grief group, you want to make sure that you screen carefully. Because the thing that happens a lot of times with grief is loss comparison. My loss is so much less, than this person's. And so that can sort of hang people up. So, for instance, I wouldn't want to have a kid who's experienced like the suicide of two family members in a group with kids who've experienced the death of grandparents. I'm making a big generalization here, but I'm just saying, like, you don't want them to be so dissimilar in terms of the loss that the one kid feels like there's this, unfathomable compared to their classmates. You want them to be able to relate a bit. Also, like the time since it happened that's passed, I think is important. So, if you've got 3 or 4 kids who've experienced it in the past 3 weeks and one who experienced it 2 years ago, that's going to be really different. So, but in general, I think those kind of groups in schools are very, very helpful and important. I see another one.
Yes, there is one more. Any tips on how to pursue grief counseling as a focus as a professional counselor?
Yeah, so there is a website. I'll put it in the chat here. The Association of Death Education and Counseling is an interdisciplinary organization, ADEC. And that's where I got my credential, certified thanatologist, which people are always fascinated by, death specialist, But it's mostly mental health professionals, but also medical. So they have a conference every year, which is amazing. And these are all people from all different professions, healthcare, that specialize in working with death and grieving people. So I would go to those conferences, do trainings there. It is by far the gold standard in terms of grief. And if you're interested in, getting a specialization, you can pursue that. It's called a CT, Certified Thanatologist. And then they also you can become a fellow, like with even more training and work with clients. So that to me is like, it's my home conference. It's the place where I feel like most connected to the people who are interested in what I'm interested in. But if you don't want to do the conference, they have all kinds of online trainings you can watch, and they get very specific, different kinds of deaf, different populations. So I would check that out.
Awesome. So informative. Thank you. Thank you again, folks, for all your questions, and thank you for joining us this morning. If there's nothing else, I suppose we will close out for today. Thank you again for spending your morning with us. Thank you again to Dr. Hall for sharing all of your knowledge and expertise. And with that, I will hit stop record.